Dr. Chenna, you reached out to me via DocTalk Live about coming on as a guest. So thank you for doing that. It's a pleasure to meet you. I looked you up a little bit. I think, are you in Kentucky?
I am. I'm in Louisville, Kentucky.
Louisville, Kentucky. That's a fun
Yep.
area. Is that's where the Kentucky Derby is and stuff?
Oh yeah, it's the home of the Derby. In fact, I was the Derby queen several years ago
Wow.
and got to kind of enjoy the Derby at its finest. So I invite you to
Awesome.
come down, check it out. I'll take you
Okay, have
on
to
a
do
tour.
that. Now, you're going to have to help me a little bit with some of the terminology. I want to use the word Ayurvedic. Is there such a thing? What type of medicine do you do?
Oh, certainly. Sorry, I just didn't hear you. I am an interventional pain physician, anesthesiologist, but I have a very strong passion for a very, I want to say integrative approach. And I'm just going to kind of explain to me what that means. So I love incorporating a lot of nutrition, fitness, meditation, and a lot of even Eastern kind of holistic Ayurvedic medicine in my practice. So I'm Indian.
Ayurvedic, there's the word,
Oh,
Ayurvedic.
yeah.
So what
Yes.
does that mean, Ayurvedic?
So it's actually kind of the ancient, not ancient, I should say, traditional Indian kind of philosophy in terms of using kind of a holistic approach for medicine and using things that are, beyond just traditional medicine. For example, yoga, meditation, a lot of kind of herbal remedies in addition to traditional medicine. So
Give us an example of a patient because, certainly I can relate to the interventional pain aspect of what you do because that's what I do. But take a patient and give us a little bit of how you might work with that patient.
absolutely. So, with really every patient that I see, I start with, telling them this is what I do. I do interventional techniques, I use traditional medicine, but then also I tell them, it is so important for us to build a relationship with one another and understand that we have to work towards building a lifetime of health and wellness. So, I don't want them to come in and say, okay, you just do injections, that's it. I want them to think long term. And for that, I say, listen, we really need to have a strong foundation in fitness, a strong core, a strong back are key to kind of preventing injury. So I talk to them about stretches that they can do. A lot of, I even have a yoga mat in my office and I literally sit down with them and say, hey, this is a stretch that's really good, for the psoas or, whatever the concern is for them. So I talk to them about yoga, meditation. Also, I work with physical therapists, as I know you do a lot as well. A lot of us, do in general as interventional pain physicians. And then, I even talk to them about ways to kind of, way to practice mindfulness. I find that a lot of people are like, I don't know, like, I don't even know what that is, and then
What
they're
is
very
mindfulness?
perfect. So mindfulness is really a very individualistic way to kind of hone in and kind of focus, I think. It's really taking the time in silence with music, whatever suits you to really kind of find your inner self and really reflect. And I think that it makes all of us stronger. And I think that's also a portion of healing and wellness and, kind of working through pain.
How do you do that?
So for me, I'll tell you what I do, and I'm
Well,
happy
I
to
want to
kind
know
of
what you
guide
do.
anyone.
I want to know how you do it with your patients too.
Oh,
That's
yeah. So I actually sit in a room with them. I talk to them about, what what is causing them the stressors in life. Pain is so multifactorial. We all know that. We read about it, but it's more than just kind of the physical pain that we're feeling. So I talk to them even more on an emotional level, about things that are bothering them, how they feel like they channel their stress, if they're able to channel their stress. And a lot of times that's, causing a part of their pain too. So, I talk through with them about ways to think through it, to, find ways to alleviate that alongside procedures that we're doing. Sometimes I'll even just turn the light off, dim the light in the room, and just we have a moment of just silence. And, we kind of talk out loud what is affecting them and kind of giving them a moment to breathe and just kind of reflect.
we recently did a show with a nurse anesthetist, and we talked about ketamine as a dissociative anesthetic. Any comment on that? I think it's very new, so I wouldn't expect you to be doing that. But that was with
Actually,
Rodney Overstreet is who we talked to about it. But go ahead.
yeah, it's interesting you say that because I also practice general anesthesia in addition to interventional pain and integrative pain. So, we use it all the time in the OR, but, of course, that's when patients are asleep. And in fact, in my fellowship, we were using it in an inpatient setting, so ketamine drips for pain. And I've actually used it in Louisville as well. It's been in an inpatient setting for pain relief. A lot of it's been kind of for sympathetic pain as well. Some of these patients I've done sympathetic blocks on, and it just wasn't enough. And they're, an inpatient, they're either pre or post surgical intervention. And it's actually worked quite well. To be honest with you, we have kind of a protocol in our hospital where we have to limit it to an ICU level care when we used ketamine drips, just administratively. But I really do see a future in an outpatient setting for it.
I bring it up in the sense of with mindfulness, sometimes it's hard to get at the core of an issue. Patients are guarded, they're armored, they're defensive, and they don't even realize it. So, and that's one of the barriers, just one of the barriers to getting
Yeah.
at pain issues. Another barrier that I face is the patient saying, "Oh, you're just saying it's all in my head, doc." And so, you've got those two things side by side. So, obviously when you have a patient that's not defensive and is willing to talk about underlying stressors, that's great. But then even if they are willing to talk about it, then you've got the fact that they're dissociated from whatever their stress is. They're guarded against it.
Yeah.
So I'm curious how you approach these various obstacles to wellness or to lifestyle change or to making a difference.
Absolutely. And you're right. It is very hard. And I certainly think that the first time I see a patient, for the initial visit, it's great if I'm able to connect and, make those changes. But oftentimes you're right. It's not. People are very guarded. They themselves are kind of confused, as to what to do, whether to trust me, and those are totally understandable. In fact, I don't blame them. Like, I really don't. But, I really spend a lot of time in the first visit focusing on this. And I tell them, and this is honestly what I say. I say, listen, I'm not here to try to put myself out of business and try to not do procedures, but I want you to have a life where you are doing what you want, whether that's cooking with your kids, whether that's going on a walk, whatever it is to you. I want you to be able to do that. And that's what I want to build for you. And I say that because I truly mean that. I am there because I want to help them live life to their fullest, and that's different for what it is for them, what it means to me. But I want them to really understand that that's our goal here, and it's not just a
So
checklist.
I'm curious as to where you trained and how you ended up in Louisville, your path. Can you tell
Sure.
tell us your path?
Yeah, for sure. I did my residency in anesthesia in Louisville, so familiarity there, and then I actually went to New York City to do my fellowship at Columbia. So I did that. I loved it. I learned so much. And, I have family nearby in Louisville. So I decided to kind of come back after fellowship and try to bring, what I learned there and kind of my passions back to Louisville and really build the program there.
Now you have an Instagram site. Do you mostly, when it comes to social media, do you mostly do Instagram? I noticed that maybe you do some yoga things on Instagram or some stuff like that. Can you tell a little bit about how our listeners may find you? And hopefully, Christy, who helps me produce the show, will hashtag it so people can find it too.
Sure. Yeah. I primarily am on Instagram. I'm on Facebook as well, but most of my material is on Instagram, and I do post a lot of exercise videos, yoga, just a lot of even just general HIIT training, strengthening. And I really try to connect it to, you know, muscle groups, because I want people to understand, you know, that when you're working out, when you're doing these things, not to be intimidated, and also to really be thinking about what you're doing and how it's going to protect your body and keep you, you know, fit, but also safe and prevent injury. So yes, that is definitely my passion. I actually was a competitive gymnast until undergrad. So
This is in Kentucky. You grew up in
days,
Kentucky?
you know, when I was just on, but you know, I have a lot of interest in that, so I try to
You
incorporate
were
it.
a competitive gymnast in Kentucky? Because that's where you grew up?
Yes,
Okay.
yeah, I grew up in Kentucky, a couple hours from Louisville, exactly.
And how did
Yeah,
you find DocTalk Live exactly? Curious. How
yeah,
did
I actually found it on Instagram when I was, you know, just kind of looking through Instagram.
Well, good. I mean, I think DocTalk Live sort of fits in with your approach to patient care in the sense that the goal is really to provide content that's actionable for patients in terms of anything health related. So it could be cardiology, it could be bone health, it could be diabetes. You know, your your um, your practices is goal, I think, is to make lifestyle changes to improve musculoskeletal conditions. So if there's something that you have that should be posted on Doc Talk Live, I'd be happy to share it on our page. I'd love that.
Oh, I love that. Thank you. I think it's awesome that we can come together, you know, as a community and really just help people in so many ways and kind of reach out to them and touch them in ways that really impact them. You know, it's hard to jive with people, you know, in just one way. So I think it's really nice to be able to do that. And
It might be
yeah.
fun at some point to do a Doc Talk Live with one of your patients if they would be willing to come on,
Oh,
and
yeah.
you could go through just like what you would do with the patient. Sounds like you have a yoga mat set up in your clinic, um,
Hmm.
you know, which is sort of like a very individualized physical therapy is the way I would describe it. But it would be I want to bring what you really do live to the Facebook community. So be thinking about that. I'm planting a seed, Harini.
That sounds awesome. And I know I have so many patients that would just love that. And they are, you know, they've really been changed by this. I tell you, even last week, I had a patient who's like, oh my gosh, like I've done so many of those exercises you told me and I feel awesome, you know, and it's so wonderful and I know you feel the same way. Like it's so great when you see patients that are truly impacted by kind of what we've talked about. And you can see it on their faces, you know, like I feel like as soon as they walk in, I can tell, like, you know, if when they're better or they're, you know,
Right,
on the road to recovery. And
right.
it's probably the best feeling I can
Yeah.
say.
And
Yeah.
maybe even if it's 3 or 4 patients, like boom, one after another, just to
Yeah.
sort of see how your clinic flows. Some won't be doing as well, some will be doing better. But I'm just planting that seed, okay?
Sure. That sounds really nice. Yeah.
Okay.
And it's so nice to be able to, I think, you know, I love going to work every day. I mean, it's just awesome. I love seeing these patients do better. And I love, you know, being able to integrate interventions with, you know, this theory of wellness and the ideas that I have to kind of meld them together, because I think that's really, really where the healing starts and
Yeah, so
ends.
somebody could hold your phone, I guess, while we do this. Um,
Oh
you
yeah,
know,
I got
plan-
a killer staff. So
oh, good. All right. Well, let's plan on that, Harini. Let's
that
let's
sounds
first
good.
see if I can get this to uh, to Christy to do something with. Okay.
Sure, that sounds good.
Pleasure to meet you. I'm gonna
Likewise. Yeah,
I'm gonna
I'm so
hit I'm
glad
gonna
to
hit
meet.
stop recording. Hold on. Stop.